1 year later, and the two Virginias are still living under the cloud of coronavirus.
How did we get here? Where are we now? What can we expect for the future?
We want to answer all of those questions and more.
Join us on March 17th at 5, 5:30, and 6 for a series of special reports on the past, present, and future of the coronavirus.
Then tune in at 7:30 where medical professionals will answer all of your questions about the COVID-19 vaccine.
A Shot of Hope, March 17th at 7:30. WVVA, here for you.
Welcome to our special coverage of the coronavirus pandemic. I'm Martin Staunton.
And I'm Melinda Zosh. We're looking back over the last year at life under the cloud of the novel coronavirus pandemic. And this special coverage is called A Shot of Hope.
And we're going to look back at where we've been as it started just a year ago today.
And we'll also look at the situation in the present, and then we'll look ahead to the future, to life after the pandemic.
We're looking at impacts in 4 areas: our health, vaccines and treatments, education, work and unemployment, as well as lifestyle. And we'll begin with the governors of Virginia and West Virginia, the men who had to make the call a year ago to place pandemic restrictions over the two Virginias. I spoke with both men about the difficulties in those early days a year ago.
We didn't have enough PPE, our testing capability. When we started, we were sending the few tests that were available to the CDC, which was all the way down in Atlanta.
I just felt like this was going to be the real tsunami, and West Virginia being the 3rd oldest state in the country with the most chronic illnesses.
And as the pandemic started to unfold, it became clear there were challenges with treating the novel coronavirus.
With a delay in testing results, Massey says many patients had to be treated as presumptive positives.
We converted our whole 3rd floor into a COVID-19 unit where that every room had a negative pressure. So if you were back in that period of time, people were laid as PUIs or patient under investigation. We weren't even doing testing early on. We had to wait.
The COVID-19 pandemic changed the education system in the two Virginias as leaders tried to keep students and staff safe while figuring out just how to implement protocols while continuing the students' lessons.
Talk about a group of school districts in southern West Virginia that absolutely are West Virginians taking care of West Virginians. I saw a message out of southern West Virginia last week. Every single boxed meal that went out of that district had a personal message to every child. Basically, we love you, we're thinking about you, we're caring about you.
The shutdown did not just put a stop to in-person instruction. It also led to an abrupt end to the final chapter in the public education of every high school senior.
Our last day of school was March 13th, and I got sick that day and I didn't get to go. So I missed my last day of high school.
That would not be the only missed event a student would experience in the closing of this abnormal spring semester. Memories like prom and graduation would also be lost to the COVID-19 pandemic.
I don't get to experience everything else that everyone else does, like my senior prom or graduation, getting to do like a senior prank or like a senior skip day and like all that senior stuff.
For months, students would plea for alternative ways to celebrate these milestone events, in which school districts like Tazewell County would get creative by hanging up banners for 130 graduating seniors from Tazewell High School on Main Street, and events like prom also taking place on Main Street. Across state lines, Mercer County schools also got innovative with a graduation parade for students where seniors got to see their classmates one last time. But then it was time to head back.
I think that parents have a horrible situation right now.
Parents, grandparents, and legal guardians are left with what they thought would never be the toughest decision for their children, and that is sending them back to school.
My decision would be for her not to go.
I want my kids to be safe, but at the same time, I know it's important for them to get back to school.
School looked different on the first day back in the classroom during the pandemic, with everyone wearing masks, glass shields separating students, and many students at home.
And lifestyle impacts due to the coronavirus were undeniable as bars, clubs, movies, and eateries were shuttered due to the pandemic. Our Christina Cass looks back.
From physical contact to face-to-face interactions, from outdoor fun to cutting into community projects. It also canceled virtually every festival and fair, and even robbed an entire generation of a traditional rite of passage. All things consistent, familiar, and normal were wiped away.
And as massive an impact as COVID-19 had on a national and international stage, the effect at the local level will be talked about and felt for years to come.
Nearly every facet of every sport, one way or another, was affected by the pandemic. Not just physically, but also mentally.
Our Hannah Howard shares where the fight against the virus stands today.
After a surge in December and January that carried the highest death tolls, the 6th week of 2021 held better news.
New confirmed coronavirus cases in the Mountain State sharply declined last week, and the number of deaths were their lowest since early December.
COVID-19 numbers continue to trend downward in the Mountain State. That number has decreased for 28 consecutive days.
Our Annie Moore walks us through how West Virginia emerged as a leader with vaccinations.
We didn't engage the federal pharmacy chain programs because we knew the relationships with the independent pharmacy chains was crucial to getting this done quickly.
Thanks, Martin. I checked in with multiple schools in our viewing area to get an idea of some of the toughest challenges those school systems still face, especially just how much virtual learning is a part of those challenges. The coronavirus pandemic may have emptied schools across the two Virginias, but the situation is filled with hurdles for leaders in the education system charged with continuing to educate students under the cloud of COVID-19.
We were asked to kind of rewrite the playbook on education. We had never done virtual or remote learning before.
Everyone's had a huge learning curve. Teachers, administrators, families, parents, community members, students.
We're adults and we're struggling with all of this and the changes that come every day. You know, these are kids and they're doing the exact same things we are.
Just adjusting to having to do things so differently, like not having assemblies or not being able to do like full-on theater productions.
The pandemic had a massive impact on the state's unemployment numbers. And as we mark the one-year milestone, unemployment is still a problem, but is it getting better? Our Maria Sellers takes a closer look.
The executive director of New River Gorge Regional Development Authority says they're taking steps to recruit companies and create more jobs across the region.
So we're working with our community and technical colleges, and WVU Tech is here in our footprint to identify if we start looking at a particular industry like aerospace, outdoor manufacturing, and those sorts of industries, what does the current state of the workforce look like, and how can we retrain those laid off individuals and utilize the skills that they already have to retrain them in a skill that's attractive to them.
Our Annie Moore sits down with the state's leaders to learn more about what could return to normal moving forward and the ways will be forever changed.
In the near future, the focus for states will move from wrapping up vaccinations for the older populations to those over the age of 16.
If we don't watch out, you're going to have another demand problem. You're going to have more supply than you got people that have arms to put them in.
Optimism is in the air, even though there's also some uncertainty about the road ahead for our education system. The hope overshadows doubts across the nation and here in the two Virginias. In West Virginia, that optimism is leading to a $32 million expense on summer programs to help students make up what may have been lost due to the pandemic.
And 1 year ago, day-to-day life looked bleak because pandemic restrictions were starting. 1 year from now, there's lots of hope for brighter days if we can put the pandemic behind us. Our Christina Cass reports.
Hope for the future fills a lot of people with optimism as they picture their lives after the pandemic.
We're getting back to where you're not afraid to go out, sit down and have a sandwich somewhere.
Strictly normal, like we was before. Everybody can just, touch things without worrying about catching anything.
I hope that everything goes back to normal and that they take the mask away is the most big thing, and that they take a lot of the restrictions away, and just that everything gets to go back to normal soon.
Some feel that life as we knew it may never quite be the same again.
Answering viewer questions about the coronavirus vaccines. We have a panel of health experts answering those questions, and we're going to dive right back into them. This next question comes from Mike Prophet in Bramwell, West Virginia, who asks, can a person with a compromised immune system from a double transplant still get COVID-19 even if they've been vaccinated?
I'll take this question. Vaccines are providing high level of protection, preventing hospitalization and death. Overall, we are not seeing severe illness in patients who have been adequately vaccinated, which adequately vaccinated means that 2 weeks after one's person has completed required dosage, but vaccines do not provide 100% protection.
Virginia resident get the vaccine in West Virginia and vice versa.
The simple answer is no, not at this time, because of the availability of the vaccines to the states.
WVVA produced 2 hours of special coverage marking the 1-year anniversary of coronavirus in the two Virginias.
We took a look back at where we were, where we are, and what the future might hold.
Are immune against the virus, hopefully due to vaccination.
And that vaccine is bringing hope, but it's also bringing a lot of questions.
Should you then try to get the Johnson & Johnson vaccine? We asked your questions to local health experts and got the answers you were looking for. WVVA, here for you.